I'm Dr. Anthony Cave, a Stanford and Harvard trained anesthesiologist and integrative medicine specialist. And there is one place in the world where we use life support more consistently and more commonly than anywhere else in the world. And that's here in the operating room. So I'm here totally live and unscripted to share with you in a live demonstration with the life support monitors behind me and the ventilator what the differences are between life support in submarines and submersibles and life support when you are under anesthesia on this table in the operating room. It's actually quite similar, and there'll be an opportunity for you to also ask some questions. But let's get started because there are a couple major points of life support that are similar, both when you're underwater and when you're under anesthesia. And as you all know, of course, our hearts go out to those and their families who were in the submersible recently on its way to the Titanic. And unfortunately, life support couldn't save the situation that appears to have happened there. But I want you to know, if you're having surgery, that our life support systems in the operating room are incredibly reliable and they work very, very well. So it's very different than what happened deep underwater. So the main points that both of them share are moisture regulation, oxygen delivery, carbon dioxide scrubbing, temperature regulation, pressure regulation, and glucose. Well, fluids, really, I should say, water. And of course, glucose is part of that, but we're not going to, it's not so relevant underwater, but we'll talk about that too. First and foremost is the oxygen and the carbon dioxide, because when you're underwater, there is no oxygen. And when you're under anesthesia, and you're not breathing, there's no oxygen in your lungs. So this machine here is a ventilator, and it has a lot of oxygen that it's connected to. I'm actually going to show you behind the ventilator what it looks like. These are oxygen tanks back here. These are usually used for backup. But this is one way of delivering oxygen to the patient who's not breathing through a ventilator and a breathing tube. Now, the corollary to underwater submarines and submersibles, if they're manned, might not be oxygen tanks because they take up a lot of space, though sometimes they do compress the oxygen, but they have chemical oxygen, we call them oxygen candles or chlorate candles, where by virtue of using a chemical reaction of sodium chlorate and iron powder, if you light that on fire, you'll actually generate oxygen. So we don't do that in the operating room, but underwater, those big tanks that you saw are hard to carry underwater. Obviously, the density is low, and if you're trying to go underwater, you don't want to be full of balloons, and you don't want to float back to the top. So they often will have different ways of delivering oxygen. By the way, Karen, thank you for that kind comment there. I really appreciate your support. I'm here after a long day in the operating room, but because so many of you asked me to talk about this topic, I wanted to make sure we get it out timely. So your support helps me do these live streams more often. Now, giving oxygen is important because the human body uses 250 mLs of oxygen a minute. 250 mLs. Just for example, if we look in the anesthesia cart here, this syringe is 50 milliliters. So 5 of these is about how much oxygen you are using a minute. So you got to deliver that, and then you have to get rid of the byproduct. What's the byproduct of oxygen or metabolism using oxygen? It's carbon dioxide, because unless you have a lot of plants in your submarine or submersible, you're going to be inhaling the carbon dioxide, and that will be poisonous to an extent. It'll also be poisonous if you're under anesthesia. So similar to what happens in submarines and under anesthesia is what's called a carbon dioxide scrubber. It's often made of soda lime. So here is the bag for the ventilator. If you look underneath it, you see this popcorn, kind of looks like kitty litter almost. And you see how it's purple at the top. This is the absorbent that has already been exhausted through absorbing carbon dioxide. And the rest of that white stuff underneath it is there that can still absorb carbon dioxide. So it's a scrubber. It's literally sucking out carbon dioxide or sequestering it. They bring those underwater as well because when you're in that submarine with multiple people, everyone's exhaling carbon dioxide, roughly a couple hundred cc's a minute as well. And you got to get rid of it in the air. Otherwise, you will have carbon dioxide poisoning, which can also happen under anesthesia if that scrubber gets totally purple. That purple there is an indicator, so we know to replace it in the middle of a long, multiple-hour surgery. We need to make sure it's replaced. Otherwise, you will have carbon dioxide poisoning. Karen, thank you for that kind super thanks. I really appreciate it. What happens with carbon dioxide poisoning? Maybe you're asking. Well, when carbon dioxide levels go too high, it is a tremendous sympathetic stimulation. Your heart rate goes up, your blood pressure goes up. If you're awake, you'll have headaches, you won't be able to focus or concentrate. It can be lethal at high enough levels. It doesn't happen when we have that CO2 sequester. And Heidi, good to see you as well. So next we have humidity, because humidity is super important when you're not breathing atmospheric air. Air is about 70% nitrogen, about 20% oxygen, and then there's some other minor trace elements in there. But you gotta have water vapor in that air as well. Otherwise, you will dry out your mouth, your throat, and the cells lining your lung. We call them the lung epithelium. So this, unfortunately, is not used in long enough cases to have a humidifier, but there is typically a humidifier, actually. It looks kind of like what you see here. This is a filter, but it does humidify a little bit. This is a passive humidifier that as it delivers gases to the patient when they're under anesthesia through the breathing tube, it will also help prevent heat and water vapor from going back into the machine, into all of the circuitry that you see here, and being lost from the patient. Now this is super important because about 10 to 20 watts of your body heat is going in to warming up the air that you inhale and also moisturizing it so it doesn't dry out your lungs. Because if it dries out your lungs, it can kill the cells in your lungs, can cause long-term problems. So whether you're under anesthesia or you're in that submarine, you need to have humidified air, because that air I showed you in the tank back there ain't humidified. It's dry, cold, and highly compressed. So when it decompresses and you inhale it, it will cause problems in your lungs. So under anesthesia, we put passive humidifiers that help prevent you from breathing all of your water, all of the moisturized water out. It collects it before it goes back into the ventilator. In submarines, they have to actively humidify that air, but they also have to suck out, they have to suck out water vapor if it's too wet, because you could imagine all of that water is going to mess up all the walls and all the paint, etc. So it's a very fine line for the environment in the submarine. Underwater, very fine line under anesthesia, because you're breathing out of a breathing tube into the ventilator. If you have too much water vapor under anesthesia, what happens is that then you risk having a lot of junk and what we call secretions, because the viscosity of your secretions goes down. You'll make a ton of this sputum. It's quite gross. That's why we have all these suction devices, as you know. You can actually hear the suction. Can you hear that suction? This goes in the back of your mouth to suction out all those secretions that might accumulate if the air that you're breathing is too humidified, because there's too much water vapor in it. So a really important concept as well is for the oxygen. When those poor people were underwater for, I mean, they weren't there too long, but if you're talking about people that are in like really, really dangerous scenarios and they're needing to use every last molecule of oxygen, you need to be very careful about how their body is reacting to minimize their oxygen consumption. So let's say you want to stretch your oxygen out as long as possible because you're waiting for search and rescue or something. Well, the same thing actually you need to worry about under anesthesia if we can't deliver enough oxygen to you. For example, if you are maybe not under anesthesia, but before you come into the operating room, if you have overdosed, let's say, on opioids. So we actually I have medical fentanyl here, for example. This is a real problem. If somebody is overdosed and they're not getting oxygen to their vital organs like their brain and their heart, what are things that are going to increase their oxygen consumption? Because you want to lower those so that you can have them hopefully have their organs live and not die out until they get rescued. Well, it's totally analogous, you'll see why, to if you're underwater in that submarine, what you can do to lower your oxygen consumption so you can stretch out your oxygen supply as long as possible. And this comes up all the time in medicine. Those are fevers, shivering, so being too hot or too cold, those totally increase your oxygen consumption. Being anxious, having a panic attack increases oxygen consumption. If you are having a seizure, increases oxygen consumption. Of course, if you're jumping up and down, let's say in that submarine, you want to lie as still as possible and you don't want to move because every movement you do is going to increase your VO2 and you want to lower your VO2 as much as possible. If you're underwater or if you're overdosed, or in many other cases in medicine, we won't go into them now, but we need to always know what increases oxygen consumption and what lowers it. And the most common variables that we can control are movement. We give paralytic agents for that reason sometimes in the ICU so that the muscles literally cannot move. We need to ensure the correct body temperature, the correct humidity, like I said, those 10 to 20 watts. We want to reduce that by delivering humidified and warmed air. And we want to make sure, of course, that the brain is preserved and that it's not in a seizure state, because seizures will absolutely use up a ton of oxygen and lead to a stroke. We want to minimize the brain's use of energy. And when you're under anesthesia, by the way, with medications like this, like propofol, or this, midazolam or Versed, you're also turning the brain off effectively because you're under anesthesia, and you also are lowering oxygen consumption. So strokes appear to be less likely when you're under anesthesia because your brain isn't using as much energy. Coach Ken, thank you for that kind super thanks. I really appreciate it. And by the way, if you appreciate me coming here after a long day in the operating room, you hitting that like button or sharing with others is really helpful to help me do this more often for you. So those are what can help us stretch out oxygen supplies. And Kathy, thank you as well. That's very kind of you. I really appreciate that. So these are how we preserve organs, including our whole body, in limited oxygen supply environments. Now water is another important thing. So we have bags and bags of, oh, and Heidi, thank you for that super thanks. Also very kind of you. So we have bags of fluid, as you know, in the operating room or the ICU, because you can't drink water under anesthesia, obviously. But you need to deliver water to your body. Otherwise, like I said, you're breathing out. You're exhaling about, it's like 0.5 gram of water a minute. So over hours, that will add up. You will be dehydrated. You need to drink water. So we give you IV fluids when you're under anesthesia through your IV. When you're underwater, though, we need to distill ocean water to help deliver that necessary fluid to your body. There's many ways of distilling water. Luckily, that's not something we have to worry about in the operating room, but you desalinate ocean water, etc. One other person gave me a super, Anne Marie, thank you for your super thanks. And Candace Strike, thank you. You said I had a bilateral simultaneous hip arthroscopy 12 weeks ago. One thing I really liked was the anesthesiologist packed no surprises. I felt I had achieved something coming back to my senses. Thank you. Well, hey, Candace Strike, I'm so happy that you had a positive anesthesia experience, and I hope that your surgical recovery has gone well in the last 12 weeks. Stacy Starr, thank you for that super thanks, and treats will go to Karma. MS Shark Bites as well, thank you. As well, Choo Choo Dono Train. I don't know what that means, Mr. Shark Bite. Maybe you could explain that to me. So I hope that you appreciated some of the big differences and similarities between being underwater. Those were all the things that I wanted to talk about. Actually, take that back. One last thing is pressure. When you're underwater, as you know, water pressure is tremendously immense and will crush you if you're not in that submersible. Well, when you're in the operating room, you're usually at room temp, at water level pressure. However, This is actually something really important that I'll bet you've never thought of. Patty Hoffman, thank you for the super thanks as well, and I'm so happy to hear that your 5 in, 5 out breathing helped abort a panic attack. That is so inspiring, I'm sure, to so many others, and I'm so happy to hear that you were able to take control of your health that way. So let me finish by talking about pressure, because this is very important. When you're underwater in the submersible, you don't have to worry about the pressure part of the life support, because that submersible is maintaining a normal atmospheric pressure. When you're at sea level under anesthesia, you also don't have to worry about pressure. However, if you go up to altitude like Denver, Mile High City, these anesthesia gases vaporize differently because the atmospheric pressure is lower. So we need to modify how much anesthesia we deliver to you as part of your life support based on the atmospheric pressure. I bet you never knew that. Luckily, it doesn't matter when you're at room temperature or at ocean level, sea level atmospheric pressure, but it's actually a very important component to any gas delivery, whether it's laughing gas or sevoflurane like you see out of the ventilator behind me. So that is the last variable that we need to monitor under any life support system. Luckily, it's not too big of a deal. Until next time, remember that you have more power over your health than you've ever been told. And please share what you've learned with others.